Yes, so we have just seen that within the laboratory we need to be extremely very careful, and sometimes even with the care that we have taken, some accidents will happen, and I really hope that they are minor. Okay, so what are the things that can lead to these accidents happening? Okay, if we understand them, then perhaps we shall be in position to avoid them in future. And that is why we are having this lesson. So we want to know the different accidents that can happen within the lab. Okay, the accidents that can happen in the lab can come from anything. It can be the reagents, which are basically the chemicals. When we talk about reagents, we refer to the chemicals that we use for we use in the chemical reactions that we experiment on in the laboratory. Okay, so the reagents that we use, the apparatus that we use, even human errors. Okay, or someone can faint and then fall down and the glasses, you get a lot of things can result into an accident within the lab. Okay, so we need to be aware of each of these elements. We need to be aware of these elements that can cause accidents. Okay, so let's check what are the things that can cause these accidents. We are saying the accidents can come from the way we handle chemicals, the way we handle apparatus, the way we handle our colleagues, and the way we manage our environments. That is where you're going to have the problems. That is where you're going to have the problems. So the first, if you don't follow instruction, problems. That's why we need to read the instructions about the experiment and also hear from the teacher. What guidance is he providing? If you just touch any chemicals around, you'll be exposed to them and you have burns. You have, and then the other issue is about the improper equipment use. Each equipment has its own use. So please use them based on what they are supposed to be used for. If you don't use them for their purpose, then you have problems. Eating around, swallowing anything can result into injuries. Okay? And then improper waste disposal is also another problem. After the experiment, where do you put your things? You have a challenge there. And then inhalation of hazards. There are some gases you shouldn't be inhaling. Okay? There are no ventilators, there is no movement of air, and you don't get fresh air, you get problems. So you don't want to have to be in the laboratory that is not well ventilated. We have gas sources. They can leak. Okay, they can leak. These leakages can cause fires and explosions. So make sure that the things are not there. The other problem can be because of how you mix some chemicals. Some chemicals can be very dangerous if they are mixed in particular conditions. So you need to know, when do we mix this and this, such that we don't have an explosion, for example. So you need to know all things. Avoid playing around with the electrical cables, electrical wires. If there are any problems, report. If you don't read it properly, if you don't understand the experiment, it's better for you not to really tamper. So lack of information about what you're going to do can cause an accident. Avoid eating anything or drinking anything within the lab. When the injury happens, of course, it has to be treated. In most cases, it can be your friend who is around and he will be the one to help you treat that injury. Okay, it can be your teacher, it can be your school nurse to give you that first aid that you need. So that's why it is very important for us to know the basics of managing injuries that we can get from the laboratory. We can actually apply these skills even at home, because even at home you can get burns, you can get someone who has collapsed, you can get someone with a wound that is bleeding. So how do you handle them? And that is why we are going to look at how to handle these things, these injuries, in our subsequent sessions. Okay, for now, we should be able to know that first aid is the first or the immediate assistance provided to a sick person or an injured individual before the professional help arrives or before the professional help is called for. Okay, so within the laboratory there should be a first aid kit. Okay, the first aid kit should be there. Why should it be there? Because the things that are in the first aid kit will be used for different purposes. And we are going to look at the different components or the things that we find in the first aid kit. So let's start. So you'll find what we call the first aid guide. It's a booklet that contains the things that how you can use some of the things and how you can handle some of the injuries that you can encounter. Okay, it's just a booklet that gives you how to handle directions on how to handle certain things, certain situations, for example. And then the plaster. If you get a wound and that wound has been cleaned, you can cover it with the plaster. And then we have the sterile gauze. Still, you can cover a wound with the sterile gauze, or you can use the sterile gauze to clean and then dispose it off and then cover the wound or the injured part with the gauze. The word sterile means it is not contaminated with any germs. Okay, so you need to handle it with proper care. Usually it is enclosed so that no germs get into contact with them. And then we have the antiseptic. The antiseptic, when you get a wound, that wound has to be cleaned such that the germs don't cause infection to that wound. So you need to clean the area with an antiseptic. So an antiseptic can include, for example, iodine, like for example that we shall see later on, or it can be any other chemical that can be used for cleaning areas around the wound and even the wound itself. And then we have soap. Everyone knows what soap is used for: cleaning. Okay, your hands, the wound, and even the equipment. Razor blade, if you want to use gauze, the gauze that we talked about, you may have to cut part of it and cover the wound. Even the bandage you can use, even some fragments of the wound may need to be cut off so that you dress the wound properly. Okay, so what we call dressing material are the things that you use to cover the wound. The gauze is an example of a dressing material, for example. And then we have the safety pin. If you tie the bandage around the wound, to secure that bandage, you can secure it using the safety pins like that. It is tight enough. The bandage is to hold, if you have a fracture, for example, it can be used to hold the other part stay in a stable position. But the bandage can also be used to in occluding bleeding. Okay, so if I get a cut and the bleeding is too much, you use the bandage to tie around the hand such that no more blood flows for occluding. The bandage can also be used for dressing. Like I said, you can put the gauze and then secure it with the bandage. Cotton for cleaning. Okay, you can put the iodine onto the cotton and then wipe. Or you can put the iodine onto the gauze and then clean the wound. Okay, so cotton is very important. Now for that, thermometer, taking the body temperature. Okay, and then the gloves. We already talked about what we call blood-borne diseases. Diseases that can spread from one person to the other if you get into contact with contaminated, infected blood. Okay, or even other contaminated substances. You need to have gloves if you are to touch any of your things. Okay, the gloves can be sterile or what we call clean gloves. The sterile gloves are the ones that are usually packaged. You have to tear to get into them. But these ones that are usually where you just pull them from the box and put them on, those ones are called clean gloves. Those gloves are not free of germs. So that's why we call them clean gloves. Whereas sterile gloves, no microbes on them as long as they are in a secure package. So you need to know the difference between the two. And then you can get also petroleum jelly. You will use this for to smear on the skin if the skin is very dry. Okay. Liniment, if you get a muscle problem, a sprain, whatever it is, you can apply that liniment to reduce the pain of the muscle. And then the torch for lighting, if there's something, if you are maybe in a dark area, you can't see properly, you can use the torch. The whistle is if you want to call for help, you can use that. You can have painkillers. For someone who has got an injury and they're experiencing a lot of pain, you give them it can be paracetamol, ibuprofen that you can find there. Gentian violet. It's a medication that can be used to treating infections and burns. If someone gets a burn, you can apply that gentian violet. Iodine, I've already explained it, to prevent infections. So you can clean the wound. That wound can be as a result of a cut or even a burn. Thank you for listening to this presentation.